Christensen.
Here.
Nelson.
Here.
Cavell. Not here. Erickson Galt.
Here.
Taylor.
Here.
Joliet.
Here.
Lubes.
Here.
You have a quorum.
Thank you. Please rise and join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our first order of business is approving the minutes from July 23rd. I have a motion by Commissioner Nelson and support from Commissioner Erickson Galt. All in favor say aye.
Aye.
Opposed? All right, the minutes are approved. Next up is approving our agenda. I have a motion by Commissioner Taylor and support from Commissioner Nelson. All in favor of approving the agenda say aye.
Aye.
Opposed? The agenda is approved. We've arrived at our first public comment. This public comment is for items on the agenda. Is there anyone from the public wishing to comment on items on the agenda? Seeing none, I will close this public comment and we will move to our first agenda item, which is a presentation from Care House of Oakland County. So I would invite Tricia Schuster to come up to the front of the table for a presentation. Welcome.
Thank you. Hello, everybody. Hi.
Good morning.
I will say the world of social work is a small world. So social workers, counselors, we continue to run into each other. So it was a pleasant surprise to see Tricia here today. And I've known Tricia for years and years and years.
Went to grad school together
Yes?
way back,
Yes.
a couple years ago. All right, so we just wanted to reintroduce for those who aren't familiar with Care House about Care House and about the services that we provide. Just so I'm not sort of reinventing the wheel here, how many are familiar with Care House? Okay. I just want to go over, there are some things that you might not know about some of the services that we provide. I'm not necessarily technologically savvy, so we're going to try this. So Care House has been around for 45 years. We started out as the Child Abuse and Neglect Council of Oakland County. And in 1989, we started providing forensic interviews for the county investigating child maltreatment cases. That became our Children's Advocacy Center portion of it. We still provide intervention, treatment, and prevention services at Care House. And I'm not going to go over all of the services for the purposes of today, but I just wanted to let you know that. She said the video probably wouldn't work, so I'll just skip over. One of the things, as you read this, I wanted to let you know, so how cases come to Care House is all of our referrals come through either law enforcement or child protective services. We do not take referrals from the public for forensic interviews. So there have to be allegations or suspicion of some form of sexual abuse or severe physical abuse if they're gonna come to Care House. We work with all of the county jurisdictions. Primarily, we work with the Sheriff's Office and Children's Protective Services. Those are the two that we can take those referrals from, and we get those often. We see anywhere from 800, really typically closer to 1,000 cases a year. And those, again, can be a myriad of things. This is just some basics about what we deal with. I think something people don't always or don't understand is that over 90% of the time, it's somebody that the child knows where there's been sexual abuse. So that is something I think that is a surprise. So that stranger danger we all teach our kids about often is actually not the case. I'm actually a forensic interviewer myself. I've interviewed close to 2,000 kids at this point. And I can tell you out of that, there's probably been a handful of times it's been a stranger. So most of the time it's somebody known or well known to the child. As it says, 60% of the time it's somebody in the family. One of the big things that a lot of people also don't really realize is what all we do for the families. It's not just that they come for a forensic interview. While the children are getting the interview, we also talk with the caregivers, somebody who brings the children, so that we know what it is they're dealing with. Do they understand what happened or what we think might have happened? Do they believe? A lot of times you get parents who say, well, I took them to the doctor and the doctor said they didn't see anything, so it couldn't have happened, right? So we provide a lot of education, a lot of support. Primarily when it comes to sexual abuse in particular, it's a really big disruption to the family and the family unit. And so we're trying to provide not only just support, but we're trying to provide where are they gonna live, if that person's the breadwinner who's the alleged offender, you know, what does that mean for this family? Crisis intervention, victim advocacy if they come to court. If our children have to come to court, we have victim advocates who can come to court with them, along with canine advocates. We were just talking about dogs. We have a canine advocate not only at Care House, but there's 3 actually at the prosecutor's office that can go to court with children if they have to testify. We also do non-emergent medical examinations. The urgent ones that are within that 120-hour window are done at through START with Haven or at Beaumont, or sorry, Corwell. I still have to get used to that new name. But we do non-emergent. So if it's past that 120-hour window, most of the time children are just not sure if something's wrong with them after something's happened. So we have a doctor who's specially trained who can do a head-to-toe physical and let them know that they're perfectly okay. If there is evidence or testing that needs to be done, we can do that. A lot of people obviously know about the sexual abuse and the physical abuse. What you don't realize, and a lot of law enforcement, even we're constantly doing education, is not only do we work with those populations in particular, but witnesses to violence. So if we have a death in the home and there's children present, then we will interview those children as well. If there's been a homicide, well, I said death in the home, but if there's just violence happening or another child has been abused in the home, but there's other kids, we will do those interviews as well. Human trafficking, we do quite a bit. When we say look-see interviews, a lot of times what that is that something has occurred around a child and they're not sure if something has happened. And in order to make sure we're not leading and not suggestive, they bring them in and we'll do an interview just to make sure if there's something that was missed. But we never, again, it's always coming from the perspective of the child. Oh, sexual assault on vulnerable adults. A lot of law enforcement aren't even aware of that. The oldest person that I've interviewed is 77, but they function at about a 10-year-old's level. So a lot of times, a lot of times law enforcement and child protective or adult protective services have a hard time with that communication and knowing what questions to ask people at their appropriate level. So they'll bring them to us because we've been specially trained to do that. A lot of services that we provide for our therapy side is we do individual therapy. We have 6 full-time therapists. They each have a caseload of about 25 that they see on a weekly basis. We have a marriage and family therapist as well, and she sees families as well as couples, and she's also trauma focused. So all of these services are specific for trauma focused types of intervention, and none of these come at any cost to the families. So we are essentially providing all of these services through grants, foundations, the Victims of Crime Act, things like that. We have family support groups that run weekly as well as teen survivor groups. A lot of people don't know about Sweet Dreams. We collaborate with them. They go in and we pay half and they pay half if a child needs basically a redoing of a room. So we have kids who have had sexual abuse happen, say in their bedroom. They have a lot of post-traumatic stress coming into that room. So we're able to coordinate with Sweet Dreams and they can come in and make a whole new room for them, which is really cool. And it's a way to move forward for these families because, people can't just move. It's just not something that's normally very easy to do. And we have On the Mend where we actually have some outdoor experiences that we can do. Court-appointed special advocates, some of you might be aware of that program. We have had that since 2001, thanks to Chuck Ludwig, who started that, who retired from the courts for anybody who might know him. But we have over 105 children in the foster care system had a CASA advocate last year. We are hoping to increase that since we have 400 plus children in foster care in Oakland County. We are hoping eventually our goal is to have an advocate for every child. So there's our lofty 10-year goal. Of course, we always need more money for that. Prevention, we do mandated reporter training. We're actually just about to launch our online program as well. So if there are people who, whether it's a school district or anybody who's a mandated reporter, if they need training, we do have an online system that we can direct them to off of our website so that they can get that certificate to show that they went through the training. We have a new curriculum that we're using, Child Safety Matters. Just went out and helped Huron School District and did a whole presentation and body safety fair with the children and the parents and stuff. It was really cool to watch. Kids are very engaged, but yet they're learning a lot. Healthy Families is a home-based program for women who are either prenatal or children up to 3 months old. Those have to have some type of risk or are currently experiencing substance abuse issues. So specifically, it's working with those families and they can work with them up to 3 years. And then Nurturing Open Parents is our family education program. We run that in the evenings. It's a 15-week curriculum. And that is run at least 2 times a year. We're actually gonna be upping that to 4 times a year as of this year.
Trisha, I would like to say something about that program. I've referred many families to that program. They absolutely adore it, love it. Because you have it twice a year and there's such a need for that, it's one family will be able to experience it. Many of my families have asked to go again, and when Care House explains the policy, the families will call me and say, can't you get us back in there again? So it is an amazing program.
It is a really good program, and actually the people who run that program are Shaka and Sharonda. So they're actually a married couple, although Sharonda's in charge. And but they run it really well, and it's nice because that way when men come for those trainings and those classes, they feel like they have somebody who can really understand from their perspective, and they're able to sort of advocate on that side of things as well. So this is just a general idea of what it is we do annually, but our biggest and proudest thing is that we are heavily involved in Oakland County. We work with pretty much all facets of Oakland County. We work within the health department. We are part of the Oakland County Protocol. That is part of the child maltreatment investigations. So we have been an active member of that since 1989. So every county is mandated to come up with a protocol on how to handle those investigations dealing with children and maltreatment. And we are lucky enough to partner with the Sheriff's Office, the Prosecutor's Office, like I said, Children's Protective Services on a regular basis. So we are very much instrumental in that part of the world, unfortunately and fortunately at the same time. But yes, I think that's it. Any questions about Care House and what we do?
I would also like to say in providing the forensic interviews, those interviews are required to be stored.
Yes.
And that at present, Care House stores those interviews at an annual cost of $15,000 to $20,000. So that's something we may consider because we store those interviews on behalf of our prosecutor's office.
Yeah, and something people don't necessarily realize as part of that Oakland County Protocol and part of state law is that we're required to do those recordings of those interviews. So if we're interviewing a child, we're required to do that interview and record it, and we have been since 2006 recording them on DVDs. In 2019, we were notified by the prosecutor's office that, well, they were running out of space. If you think since 2006 till then, we were doing 1,000 interviews a year. You can imagine how much those DVDs are for storage. They're also degrading. So we looked around, found out there was a system that was specifically geared towards these forensic interviews, which is Guardify. And what they do is it's a cloud-based system. It's heavily secure. It's, like I said, specifically made for this. And part of our county protocol is that while we do the recording, it is not our possession. That is actually it is in the possession of the prosecutor's office. That is part of the county protocol that everybody signs. So it used to be law enforcement, when they were there for an interview, would have to sign for, chain of evidence or chain of custody, put it in a safe, and then somebody from the prosecutor's office, an investigator, would come over, get it, and then log it back in. Now what we're able to do is we're able to notify somebody from the prosecutor's office that we've uploaded that DVD, or not DVD, sorry, I'm too used to that language. Uploaded that recording, and then the person at the prosecutor's office then takes it and transfers custody to the prosecutor's office, which means we no longer have custody of that recording and we can't access it, which is good because it takes us out of that chain of evidence type of thing. So it can't be us sharing any information. We also can't be subpoenaed then by any entity saying we want that copy of that recording. That does come with all of this lovely technology, comes at a cost. So that was something that, yes, we were hoping would be considered because it is something that is necessary for not only the prosecutor's office, but sheriff's office, child protective services. Lots of entities use that system.
Thank you. Any questions or comments for Tricia?
A quick summary of everything I was trying to.
No, you did a great job.
Thank
It's
you.
all inclusive.
Yes.
So thank you for coming.
Yes,
All
thank
right,
you.
yeah, we will have more discussions.
Okay, sounds good. Thank you. And if anybody has any questions, always feel free to contact me.
Okay, so I need a motion to receive and file the presentation. I have a motion by Commissioner Nelson and support from Commissioner Taylor. All in favor say aye.
Aye.
Any opposed? All right. Okay, we move on to communications. There are 9 items under communications. The majority are the reports from our ARPA-supported programs. We also have the animal shelter report, grant application, and the last item is an amendment to a previous grant program. Yes. Yeah, do you have questions or you want to move communications?
Question.
Okay,
I just wanted to say, I wanted to draw everyone's attention down to the third communication item. It's the chore report, quarterly report through June 2024. Some really great information in there. I'm really happy to see that 18 communities applied during the first round. And 16 out of the 18 now have active contracts and are moving forward with their plan. So definitely I want to thank everybody involved. I know OLSHA has been a significant partner within this program, but definitely wanted to highlight the information in there is really great.
thank you. It does make a difference in a person's life.
Absolutely.
Thank you. Any other comments? Right, all in favor of approving the communication, say aye.
Aye.
Opposed? All right, our communications are approved. Our first regular agenda item is a district court recommendation, an amendment to the Michigan Mental Health Court Program. I have a motion by Commissioner Nelson, support from Commissioner Joliet. And I would invite Chris Bujak up to talk about this item. Am I on the right
No.
one?
I'm Alex Black.
Oh, Alex. Alex, thank you.
Hi, good morning, how is everyone? I'm just here to request more funds for our mental health court. We're allowed to accept the funds that they've given us. We went back after the first and second quarter to request more funding for our mental health court liaison. When we applied for the grant, they only grant what you used the year before, but they don't take into account that you asked for more money because you know that you're gonna need more money. So we keep having to go back for reallocations. Luckily, because we have good reason for the reallocation, SCAO is constantly reallocating money to us, but that requires that I come here and ask that we be able to accept that. So the money that we've requested for reallocation will cover the rest of the salary for the mental health court liaison that we have through OCHN. That's really it in a nutshell.
Perfect. Any comments or questions regarding this item? All right, would you prompt the vote? No.
Lubes,
Yes.
Nelson,
Yes.
Powell,
Yes.
Gershenson,
Yes.
Taylor.
Yes.
You have 7 yeas, 0 nays.
All right, motion carries. Thank you. Our next 2 items are from the sheriff's office. The first is creating 2 part-time positions to reinstate security at the North Office Building. And the second item is a grant acceptance for 2025 Secondary Road Patrol and Traffic Accident Prevention Program. I have a motion by Commissioner Nelson, support from Commissioner Joliet. Welcome. I have a new face here.
Yes, so good morning. Gay up here with the Sheriff's Office. I also have Major Perry with me and Tom Hardesty from Homeland Security, is it? Okay. I know. The title's changed, but anyway, the first item is for 2 part-time positions to be reinstated to provide security at the North Office Building. And that's one of Mr. Hardesty's buildings. Back in 2022, we had positions, we deleted those positions, and the state had provided private security. That arrangement didn't work out that well, and so the county exec approached us to reinstate our position. So we're asking for approval for that. The next item is our annual secondary road patrol. and Traffic Accident Prevention Program grant acceptance. So this year we have been awarded almost 1.7 million. It's the 46th year for this grant. If you recall, a couple of years ago, they used to give us an initial allocation. It wasn't enough to fund all our positions, so we had to delete and create. Last year, they passed some legislation, so they solidified the funding, so all of our positions are solid. This year, they're giving us an additional allocation of $494,552. So that's a one-time allocation. So we're looking at putting that towards overtime and then any kind of materials and supplies and equipment that we can use for that program as well. So we're really excited about that because this program is stable now and we don't have to come back every 6 months to delete and create positions. So those are our two items today.
Thank you.
Happy to answer any questions.
We do enjoy accepting the grant money. All right, any comments or questions? Would you prompt the vote, please?
Lubes,
Yes.
Nelson,
Yes.
we have 8 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you for your support.
Our next item is Health and Human Service recommendation. It's an application for a 2025 Pontiac Integrated Urgent Care. Oh, I have a motion by Commissioner Powell, support from Commissioner Taylor. And Leanne is here with us by video. Welcome.
Good morning, everyone. Thanks for having me. So this grant is actually a rollover from the initial grant that we received actually 2 years ago. And so the state actually doesn't take away the money, but they kind of make us reapply for it. But I know the number in front of you says $1 million. When it comes through, we know that it will be more. It will be what we don't use in this fiscal year. And so if you remember, we've been talking about this quite a while now, is the integrated urgent care or walk-in clinic that we are hosting in Pontiac. Our three biggest partners are the primary care, which is Honor Community Health. Oakland Community Health Network is providing the behavioral health care, and then OLSA will be coming in and helping us provide those wraparound services for individuals coming in. So we're expecting to use about half of the $5 million that we used by the end of this year. So we'll probably be rolling over about $2.5 million. So we will be coming back to answer that $1.5 million very soon.
It's interesting that they allow the money to roll over. So that's actually a good business practice. I'm pleased to hear.
We're very lucky that the state partners, recognizing that this is an important model, right, that we hope to replicate in other parts of the state and the county. And so really giving us an opportunity to get that up and running in the right location.
Thank you. Commissioner Powell?
Can you be a little more detailed as to what Wraparound Services OSHA will be offering? And then that's one question. The second question is, are they gonna have staff within our building conducting that? Or will we be hiring staff to assist? The reason why I'm asking is because I sit on OSHA board and we have our own issues with staffing and stuff going on over there. So I'm just trying to figure out how they gonna help us and we got our challenges over there. Thank you.
Yeah, so the goal will be that they would have staff directly in the integrated urgent care. I am still working with Susan Harding on the details of that, so that's to be coming. But they have been a part of this really from the beginning, knowing that we want to provide those welcoming services. So, for example, if someone comes in, right, we kind of use this as an example, they think they might be having maybe it's a heart attack, maybe we find out it's some kind of behavioral health issue, right? So we're all working together, kind of a comprehensive look at this individual, and maybe to find out they're struggling to pay for their heating, or they're trying to, maybe it's a grandparent raising their grandkids, and so they've added that complexity to their lives. And so OLSA has all of those resources that they can help that individual before they walk out the door. So the contract with OLSA will be coming very soon. And at that point, Commissioner, I will be able to talk a little bit more about those services that they're going to be providing. Just so you know, currently OLSA is in our Southfield building. So they have an actual staff person in our Southfield building providing resources.
Okay. All right, thank you.
Any other questions or comments? We are excited regarding the three entities coming together to provide really a wraparound service. Thank you. Would you prompt the vote, please?
Boobs,
Yes.
Nelson,
Yes.
Howell,
Oh, yes. Oh. Oh, no, she know I'm a yes.
Cavell.
Yes.
I didn't talk to Leah, she know I'm a yes.
Motion carries. Thank you.
Oh.
Our last agenda item is from Emergency Management. It's a grant acceptance for the 2023 Homeland Security Grant Program. And Mr. Seeley and Ms. Dance are here to present that, but I need a motion. I have a motion by Commissioner Joliet, support from Commissioner Erickson Galt. Welcome.
Welcome. So the Homeland Security Grant is our annual grant that comes from FEMA. It is a 3-year grant cycle. It's usually we get it about a year behind because after FEMA approves it, it goes to the state, and then the state sends it to our fiduciary with UASC, which is Macomb County. They've got to run it through their process. And so we get it about a year late. So it's a 2023 grant we're getting now. We have until 2026 in order for the money to be spent. We're increasing only $1,400 from last year. This grant's kind of been pretty steady the last several years, and hopefully it'll stay there. It's a total of $36,000 from the state Homeland Security Grant program, $536,000 from Urban Area Strategic Initiative, and $220,000 for regional projects for a total of $792,675. Those regional projects, we have 2 solution area planners that work out of my office that take all the grant projects and do all the paperwork back to FEMA, and then do all the purchases for under the grant. And then there are 2 positions that work at the DSEMIC, the Detroit Southeastern Michigan Intelligence Information Center. They're sheriff's office employees, but they're paid through this grant. So that's what the grant pays for. We're here to request acceptance of the grant for 2023.
Thank you. Comments or questions regarding the grant? Commissioner Cavell?
Thank you, Chair. 2 questions. If the funding is going up by just $1,400 and there are 4 positions, where does the 2.4% COLA come out of?
The $220,000 is at their top pay. So right now, nobody is at their top pay. The 2 analysts have under a year on, and the 2 solution area planners were hired 2 weeks ago.
Okay.
So everybody's below their highest level of pay, so that money is not in jeopardy at all. And we always have, actually there's always additional funds. Those are regional funds, so they're the entire USC region. There are always additional regional funds because those planners for all the counties and the DSEMIC analysts, usually there are vacancies somewhere within the year in all of those positions. So we're able to cover it with different vacancies, and they usually run well into the grant.
Okay. And my second question is, what does an intelligence analyst do? What intelligence do they need to acquire?
So they work as a part of the MIOC, the Michigan Intelligence Operations Center in Lansing. They do intelligence gathering for all of our major events. They do security analysis of events prior to the events happening. So they just did the Woodward Dream Cruise. They do analysis of it, and then during the Woodward Dream Cruise, they They conduct intelligence gathering information to see if there are any bad actors that wish to do anything negative toward Dream Cruise or anything else. So they do some stuff with schools, but a lot of what they do is more general intelligence gathering for bad actors that want to affect the entire USC region, but also Oakland County.
The USC region is,
It's St. Clair County, Macomb County, Oakland County,
right,
Washtenaw County, Monroe County, Wayne County, and the city of Detroit.
and Oakland County has 2 of those. Are there more intelligence analysts?
There are 6 intelligence analysts. There were 7 originally, for all 7 entities had 1. They reduced that number to 6, and Washtenaw and Monroe combined their analysts together. Over the years, Washtenaw and Monroe couldn't afford to keep people, they weren't paying them enough, and same with St. Clair. So their analysts came to us and to Monroe County, or to Macomb County. Macomb County has 2, we have 2. That's because 2 other counties in the region could no longer support having the analysts in the dynamic. So we have taken that up.
So then does that mean we're doing intelligence analysis for like U of M football games in
Yes,
Ann
sir.
Arbor?
Yep.
Does Washtenaw County pay us for that, or does this grant help cover some of the cost of that? That is not just like the formula grant from the feds that this is?
This grant pays their entire salary for the center. The center itself is run by Michigan State Police, and all of the analysts are paid through whatever counties are hired through this grant.
Okay, so then, in a sense, if I understand you right, state police gives Washtenaw County and all of us money. Washtenaw County, when we use our time and talent to watch their football games to make sure there isn't terrorism or whatever, the Washtenaw doesn't give us like a per hour rate. It's just Washtenaw doesn't give us any money for that.
No, they're all part of the USC region, and anything within the USC region is what those intelligence analysts are looking at.
Okay, cool. Thank you.
Any other questions? All right, would you prompt the vote, please?
Boobs,
Yes.
Nelson,
Yes.
Powell,
Yes.
8 yeas, 0 nays.
All right, motion carries.
Thank you very much, Commissioners.
We've arrived at public comment. Is there anyone from the public wishing to comment on anything? Seeing none, public comment is closed. Our last item is other business. Does anyone have any other business to bring up? Seeing none, I will close the Committee of Public Health and Safety meeting at 11:05. Thank you, everybody.
All right.